Hello doctors, welcome back to Job Studies Med Fun. I'm Dr. Aishwarya Mukkal and this is your first part for previous year images, that is PYQ based images questions for PSN. So let us start with our topic. The first topic is contraception. Very important topic because a lot of questions can be asked from this one single topic, theory as well as image based questions. The first kind of methods that we are going to encounter here are the barrier methods of contraception. The first and the most commonly used is male condoms. So male condoms are made of latex. They are under the program called Nirod or prevention of pregnancy. The Pearl index for male condoms is 2 to 14, and the benefit of male condoms particularly is protection against STDs. So before we move further, what is this Pearl index? So Pearl index is the number of pregnancies occurring in 100 women who are using the same contraceptive method for about 1 year. So the lower the Pearl index, the better the contraceptive method will be. So the next contraceptive method we have over here is female condoms. In female condoms, there are 2 rings present. However, in male condoms, only 1 ring will be present. It is also made out of latex, and the Pearl index for it is 5 to 21. Again, it prevents STDs. Next one is vaginal sponge. It is marketed or sold under the name Today. So it combines barrier and spermicidal methods. It is saturated with, very important to remember this, 1000 milligram of non-oxynol 9, which is a spermicide. It is inserted vaginally prior to intercourse and placed over the cervix. It is left in place 6 hours after ejaculation. The disadvantage of this method is there is no protection from STI, and if the patient forgets to remove it, or if there is any chances of infection when inserting it or removing it, there is an increased risk of toxic shock syndrome, and there is a possibility of yeast and UTI infections. The Pearl index is quite high, it is 20 to 40. The next one is vaginal sponge. In vaginal sponge, it is placed over the cervix to be effective, and its Pearl index is 5 to 20. The next kind of contraceptives that we are going to encounter are the intrauterine contraceptive devices, that are the IUCDs. The first one is a recently asked question, Lippy's loop. It is first generation IUCD. It is a very old kind of IUCD. It has the highest failure rate among IUCDs, and it is non-medicated right now and inert. It's not used anymore, but in the July Fmge that they had conducted recently, this was an image-based question, straight up asked. They put the image, they asked what kind of contraceptive it is. The answer was Lippy's loop. The next one we have is CUT380A, also known as the copper T. It is the second generation IUCD. It is bioactive. 380 signifies the surface area of the copper used. A signifies vertical length of the limb. It is freely available in the National Family Planning program, and can be inserted for a duration of 5 to 10 years. Again, asked in the exam. So you have to remember, it is a T shape, straight up T shape with a blue thread, and the copper wire is wrapped around both its arms as well as the vertical arm of the copper T IUCD. The next one is multi-load, also known as CUT375. In multi-load, you will have this inverted U-shape type wings with these sort of rays coming out of it, and the copper wire will be wrapped around the length of it over here. That is your multi-load. The next one is Nova T. It is also known as CUT380AG. It is another one. it is pretty easy to recognize. Again, it will have the copper wire wrapped along its length, and the arms will not be straight. They will be coming, it will be like they will be sprouting out of the vertical arm. The next one is Mirena. It is another important, that is LNG 20. Very important for the exam, very important for NEET PG exam as well. So it inhibits ovulation. It thickens cervical mucus, preventing the transfer of sperm. It contains 52 milligram of levonorgestrel, and it releases 20 microgram of levonorgestrel per day. It has the least failure rate out of all the IUCDs and can be inserted for the duration of 7 years. The last one is Progestasert. What does Progestasert have is 38 milligram of progesterone in a silicone oil reservoir, and it releases 65 microgram of progesterone per day, and it can be inserted for the duration of only 1 year. So the next ones that we are going to encounter are OCPs, or oral contraceptive pills. The first one we have over here is a Chaya tablet. So also known as Saheli or Centrocroman. It is once a week pill. The next ones are Mala N and Mala D. So Mala N and Mala D, they have the same composition. They have the same tablets. They have the same number of tablets. The only difference is Mala N is free, Mala D is charged. That's all. So what is their composition is, they will have 21 active tablets which are hormonal, which contain ethylene estradiol ethylene estradiol per tablet will be 30 microgram. Levonorgestrel per tablet will be 150 microgram, and there will be 7 iron tablets which contain 60 milligram of ferrous fumarate, which has 19.5 milligram of elemental iron. Ethylene estradiol 30 microgram, levonorgestrel 150 microgram. The iron tablets will have 60 milligram of ferrous fumarate, that is 19.5 milligram elemental iron. The same composition will be seen in Mala D. The only difference is it will be charged. The next one we have is injectables, Antara. Antara is an intramuscular injectable hormonal contraception. It's commonly called DMPA, depot medroxyprogesterone acetate. Permanent methods of contraception. So these are surgical methods. The first one is tubectomy, done in females, where the fallopian tubes will be sealed closed, and the most common technique used here is Pomeroy's. The next one is vasectomy. It will be used in males. The most important question that related to this has been asked in the exam, theory question, is what is the advice post vasectomy given? Most common or most important advice given post vasectomy to a patient is use barrier methods for 3 months. Natural methods of contraception include the following. The first one is fertility bracelet. The female will wear the fertility bracelet, which will have this different color beads, and they will have like a small black colored rubber band that she will keep moving according to her day of the cycle. So she will just move the bead onto the next. So these white ones have been tagged as ovulation. The red one has been tagged as the first day of the menstrual period. It is a form of calendar method. The next one is Billings ovulation method. It is also a form of calendar method. It tracks your menstrual cycle. That's it. That it tracks the fertile period, that is the ovulation, and it tracks the infertile period and the menstrual cycle. The next topic is vaccine storage and monitoring. The first image, frequently asked, very frequently asked, vaccine vial monitor. So what happens in vaccine vial monitor is, we are all familiar with this particular way of monitoring the vaccines is, they will have a sticker on top of it. They will have this sticker on top of it, which will be a circle, and it will have a square inside it. So what happens is, when this square is lighter in color than the outer circle, or it is either white or lighter, then it is safe to use that particular vaccine. But if the color of the square becomes the same as the outer circle, or it becomes darker than the outer circle, it is not safe to use. It is all listed in this chart over here. The next one is ice-lined refrigerator. The question asked related to this was heart of cold chain. What is the heart of cold chain? That is ice-lined refrigerator. The temperature that is maintained in ice-lined refrigerator is 2 degrees Celsius to 8 degrees Celsius. The next one is dial thermometer, another kind of method used to monitor the temperature in cold chain. It records temperature twice a day. The next one is vaccine carrier. It is used in vaccine administration in vaccination camps, where you go from door to door vaccinating the kids of a village or something. There you can see that there are they use ice packs for it. So these white this has also been asked. An image of ice pack was given and it was asked, where do we use it? So you use it in a vaccine carrier. Stem alcohol thermometer. It is again used in ice-lined refrigerators. So that's it, doctors, for today. So please follow our Fmge mantra. Please keep revising your topics. Please give grand tests and keep reviewing all the questions that you have answered. And please keep solving image-based questions. Thank you.